Welcome everybody to this evening's program. First of all, I want to thank Sarah Palin, who needs no introduction, for suggesting the topic for tonight's discussion.
Well, Larry, you know how interested I am in healthcare, and the recent debate in the New York Times regarding dental x-rays is close to my heart because of my children. We all want the best we can for our kids.
Quite so, Sarah. In fact, that is the reason for my other guest being here tonight. Welcome Dr. Rentgen, who is an eminent authority in dental radiology. Thank you, Larry, for inviting me. Well, Sarah, would you to tell Dr. Rentgen what's on your mind?
Dr. Rentgen, like many people, I am worried about x-rays and cancer. Especially for my kids. Can you explain the risks to me?
Every time a person has an X-ray examination, there is a very small chance of developing cancer some years later. Doctor, when you say small, just how small is small? If you go to a dentist and he or she takes 20 small X-rays, what we call a FALMOUD series, the risk is about 1 in 50,000 that you will develop a fatal cancer.
1 in 50,000? That sounds awful. I would rather take my chances hunting bears.
Sarah, what is the risk of being killed by a bear?
Now, Dr. Rentgen, I was just making a joke.
I realize that, Sarah, but you actually raise a serious question. How dangerous is a risk of 1 in 50,000 compared to other everyday activities we do? Doctor, that is a great question. Can you give us some help here? Sure. If you drive about 800 miles, say Miami to Philadelphia, there is about a 1 in 100,000 chance of a fatal car crash. So if you did the round trip, the risk is the same as having 20 small dental x-rays. When you put it in those sort of terms, the risk is actually quite small. Unless my wife is driving. Oh dear. She will kill me tonight.
Larry, this is no laughing matter. There is also something else to consider. If I go on a long drive, I now know there is a small risk, but it is balanced by the fact I will be seeing relatives or taking a vacation. So I feel the risk is worth taking. Doctor, how do the risks and benefits work in dentistry?
Very good question, Sarah, and not that easy to answer. I suppose we could look at the benefits and risks of using the large panoramic X-rays to find a cancer of the mouth. If you are a non-smoker with no known risk factors and you have nothing abnormal to see in the mouth and no symptoms, then it is probably one chance in 1 or 2 million that you will have an unexpected cancer. However, the risk of getting cancer from the X-rays is about 1 in a million. So you may produce more cancers from the X-rays than you detect. But, if you are a smoker, and you have a painless ulcer on the jaw that has been present for several months, then it may be only 1 in several hundred that you have a cancer, and the X-ray might detect bone destruction. A better test would be a biopsy, not an X-ray, but we are getting into too much detail, I think. So doctor, let me see if I have got this right. If you pick a situation where you think there is likely something serious to be found, the benefits of early detection outweigh the cancer production risk. Did I get it right? Exactly, Larry.
But wait a minute, doctor. Dental x-rays are taken on about half of all Americans. Do you have any idea how many Americans are getting cancer from dental x-rays?
It could be as many as about 500 Americans every year.
That is terrible.
Again, Sarah, you have to look at the big picture. There are about 40,000 per year killed in automobile accidents, but we know there are great benefits from driving. Yes, but doctor, we have safety campaigns and seat belts to reduce automobile accidents. What is the dental profession doing to reduce radiation-related cancer deaths? Over the last 20 to 30 years, more sensitive film and digital X-ray detectors have been developed. The old-fashioned D-speed film can now be replaced with F-speed film or digital detectors, and this requires about 75% less X-rays. In addition, dentists can also reduce the size of the X-ray beam from round to rectangular with a little device called a rectangular collimator. This further reduces the radiation to about 1/10 of the dose. Doctor, this is getting a bit complicated. If my dentist uses the lower dose film in collimator and they take 20 films, what is my risk of cancer? It drops down from 1 in 50,000 to 1 in 500,000. And do all dentists use these better techniques? Unfortunately, about half of all dentists still have to adopt these techniques. Many believe that the higher dose films give better pictures, but many studies have shown that the diagnostic accuracy is the same with the lower dose methods.
Doctor, I'm a country gal who understands practical things like hunting and fishing. If all dentists were to adopt these lower dose techniques, how would that affect the number of people getting cancer from dental x-rays?
Well, Sarah, it would probably cut it down by more than half, so it would go from about 500 down to 250 or less.
Well, I shall make sure my kids go to a low-dose dentist in the future.
Well, folks, that just about wraps it up for another night. I want to thank my two guests for this very interesting discussion.
Thank you, Larry. I will go back to watching the Russians from my backyard.
Larry, it has been a pleasure. That's it, folks. Good night.